after my mom passed away, I reached out to Professor Clive Bowman, Professor of Gerontology at City University, London, and one of the editors of the Care Home Handbook. The Care Home Handbook was a book I did not know anything about until I contacted Dr. Sadia Ismail, who's one of the members of the advisory board. She's a consultant pediatrician in Leeds. And she sent me this big tome, which had a wealth of information in it, written specifically for workers and carers in care homes in the UK. Professor Bowman has been very generous with his time and his advice, and has been a real support during this project, and he's one of our directors. I now invite Professor Clive Bowman to say a few words about home care for the elderly.
Hello, everyone. I'm Clive Bowman, and I'm a doctor, as Sanjay has said, with some international experience of ageing and care. And I'm delighted to set the scene for the launch of PremSaver today. But at the outset, I would like to pay tribute and congratulate Sanjay, Shabada, and their colleagues who have worked so hard to bring the PremSaver project to life. So I'd like to set the scene and explain our intention. And it's that PremSaver will offer an important resource that could transform the care of frail older people through supporting those organising and providing their care. Now, as doctors, we diagnose and treat our patients, and together with our nursing and other professional colleagues, collectively contribute to a patient's experience and outcome whilst under our care. For people with continuing personal care needs, when they return home care becomes the ongoing responsibility of others, typically family, friends, and paid carers, who often have little or no experience or knowledge of the how or what to do. Now, a very long time ago, when I was a consultant physician and gerontologist in the NHS, I had an excellent team of specialist nurses and therapists, and one of their key functions was to enable the discharge of patients home, which often meant training family and friends to provide care basics. We extended this to care homes where at the time those same skills were often limited. And one of the learnings from all this was, whilst there may be a number of ways to provide care for frail and vulnerable people, consistency is part of ensuring safety. Now, I know these days in the UK, such services are often impossibly overstretched, and internationally, they may not be well developed. The result is that wherever you may live, the often simple but essential skills people needing care require are simply not easily accessible. With the ageing of societies across the globe, this is a growing challenge we all confront. Now, just for a minute, imagine boarding a plane and learning that the pilot has not flown before and did not have access to training or operating manuals. I guess, like me, you'd be disembarking with some urgency. Well, that is not so dissimilar to the situation confronting older people needing care, but quite simply, they can't jump ship. Families in India will want to provide or ensure the care of their elders is safe and sound, but where to start and how to do it are the challenges PremSaver seeks to address. Yes, you can Google and YouTube, but you will struggle to find a considered and coherent approach that provides a professionally developed flow of assessment of need and guidance on how to provide care. Now, digital solutions have increasingly supported many long-term conditions, most recently in the mental health area. But the space that PremSaver is targeting is underdeveloped, which makes this an exciting and important proposition. And I hope you will share our enthusiasm for the project by the end of this launch. I thank you. If I hand back to you now, Sanjay.
Thank you so much, Professor Bowman, for those very kind words, and also giving us an international perspective on a very important issue.